I have literally spent the last 15 years helping people overcome fibromyalgia and many other chronic health conditions. I'm going to share my simple functional medicine recovery strategies in just a moment.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions. Let me introduce Dr. Mark Dailey.
If you're watching this video, you probably are struggling with some kind of health condition. I'm going to speak to you today about fibromyalgia because it is the diagnosis of people who have had a chronic condition over a long period of time and what they generally end up in. That's kind of the basket that they end up in. Many times fibromyalgia patients have already been diagnosed not only with fibromyalgia, but irritable bowel syndrome, diabetes, clinical depression, Hashimoto's, lupus, scleroderma. I mean, the list literally goes on and on. So these are complicated cases. Now, if you've got irritable bowel syndrome as your main problem, it's a lot easier to resolve that. My point is that once you're diagnosed with fibromyalgia, there are normally many things going on at the same time. I refer to them as multiple levels of dysfunction. So helping the fibromyalgia patient is what I have done for the last 15 years, as I mentioned, and it's a lot harder than helping someone with just one or two underlying issues. So how do we help people recover from fibromyalgia or any chronic condition? Well, the first thing that we do is a complete and thorough health history. So this is a conversation that can take 30 to 60 minutes, depending on the individual. I might add, some people don't talk to their primary care physician for that long, 30 to 60 minutes, over a decade. A lot of times it's just 3 or 4 minutes in and out. And this is often what it takes to actually help a patient and find out what their concerns are and dig deep into their history. So this is absolutely vital because during this health history, I get to find out if parents suffer from a chronic condition, what's going on in the family. So we're looking at family history. Also, we need to look at travel history. Where you been? There are certain conditions that you may be more prone to get living outside the country or even visiting a foreign country. We find out what diagnoses the patient has already received from their physician. We consider trauma, both physical and emotional, that could be a complicating factor. We look at dietary and lifestyle issues that may contribute to the current health concern. We also look at potential mold exposure, heavy metal toxicity, as well as environmental toxins. You got to think outside the box with these chronic conditions. Not only that, how about medications you're currently taking? So once we've gathered the appropriate health history information, we then consider which advanced laboratory testing would be the most appropriate for our patients. I often like to do a food sensitivity test because it shows me the foods that you're eating every day that may be driving your condition, aggravating your immune system. I almost always do a stool sample because I want to find out what's living in your gut. That would include yeast overgrowth, which is a fungal infection, pathogenic bacteria, which are bad guys, as well as parasites, and any other abnormalities in your digestion and your absorption. I often do something called an organic acid test, which is done through urine. And with that, I'm able to see nutritional deficiencies, neurotransmitter imbalances, signs of digestive problems, as well as mold exposure. We can also see if there is a problem with the mitochondria, which is your energy source, your powerhouse in each and every cell. So if we see this as a potential problem for the patient, we may check for mold exposure, environmental toxins, even heavy metals. All of this advanced lab testing is really, really important because it helps us to define the enemy, the hidden aggravating factors that are actually causing your problems. So once the test results are back, we create a treatment protocol that involves dietary changes, lifestyle changes, and the introduction of pharmaceutical grade supplements designed to target areas of deficiency, as well as kill any parasitic infection, yeast overgrowth, and pathogenic bacteria. So we also introduce techniques designed to detoxify the body, which include pharmaceutical grade supplements designed to open up these detoxification pathways. And there are techniques designed to help speed the process of detoxification. Once we've accomplished this, we go back and heal and seal the gut lining, which is vital because at this point, the lining of your gut has been damaged and can also no longer, in many cases, keep food particles, proteins, from slipping from your gut into your blood. Again, this causes immune system overactivation and it causes systemic inflammation. When I say systemic, that means from the top of your head to the bottom of your feet. And the results of this systemic inflammation might be fatigue, skin outbreaks, brain fog, or just pain all over your body. Once that step is completed, we start adding foods back into your diet that are nutritionally dense. We're building you a big, beautiful diet for life. Now, this is a condensed version of the functional medicine protocols that we've used over the years to help people just like yourself recover from fibromyalgia or any other chronic health condition you suffer from. If you check out this page, you will actually find some case studies where I show you exactly what I find in different patients so you can have a little bit more insight into common findings and hidden triggers. If this video has been helpful, please like it and subscribe to the channel. We try to put out a video every week that would be helpful to the recovery of those suffering from chronic conditions. If you would like to work with me one-on-one, I do offer a free initial consultation, and that information will be here in the description. But thanks so much for your time and attention. God bless you, and have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.